Good afternoon. Namaskar. I am I am Dr. Raju Vaishya, Editor-in-Chief of Indraprasth of Apollo Medicine Journal, and I am also Senior Consultant Orthopedic Surgeon at Indraprasth Apollo Hospital, New Delhi. On the occasion of International Women's Day today, I will be talking to a leading gynecologist from Indore city, Dr. Kawita Bapat. She also happens to be our active editorial board member of Apollo Medicine. And since Apollo Medicine believe in gender diversity, uh, we are very happy to have female editors in our portfolio. And I'm sharing this that uh, the national average for medical journals of female editors is around 9%, but we are proud to have about 20% female editors in our editorial board. So today I'll be talking about a topic which is of quite interest and attention for general public as well as for the government, that is STEM. STEM stands for Science, Technology, Engineering and Mathematics, which is an umbrella term which also includes medicine, which Dr. Kavita is also part of it. So, as I start, let me ask Dr. Kavita, what is your personal journey in STEM and what initially inspired you to pursue a medical career, and how long has this journey unfolded so far?
Thank you so much, Dr. Raju. And first and foremost, that you have given me the chance to have an one-to-one chit chat with you, as in on the stage of Apollo Medicine, as being a chief editor of Apollo Medicine. I'm really happy. And the question you are asked, why I have chosen this career and all, I tell you that being a daughter of a doctor, you can say, number one. Number two, my aunt was also a doctor. And the most important was one of my grandmother. She was the sister of my grandmother, the Dr. Fatak. She was the first FRCS of Madhya Pradesh. She was my maternal grandmother on my side. So all those people around me. This is one of the reason that I inspired to become a doctor, honestly. But I think the role of my mom is very much is there. The trust in me. She believed that I should go for this career, basically. And seeing my father and everybody going to hospital, taking care, and most important, the respect he had in the family, which I think which was very, 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 very imbibing and very important for me at that time. And all the small, as a child, as a gadgets, unnecessary cutting of the dolls and stitching them and doing putty and dressings and whatnot. That was the thing. And then when gradually we grew, I think the science talent exams and all the science projects, I think I was lucky enough, honestly, that I could go for all those things. So I think these are the all things which helped me to pursue the career in STEM. And I think I was very, very lucky, though it's not much challenging, but it was still challenging to say to pursue this career in my life, like you can say. And I think I'm lucky. You're not audible, Dr. Raju.
Thank you, Dr. Kavita. And as we can understand, that your family background of doctors actually helped you or rather encouraged you to take medicine and help patients in your professional career in future. But did you encounter any specific challenges being a woman in this field of medicine? And if so, how did you overcome, and what lesson did you learn during your journey?
I'm so happy that you have given me the chance to talk about the challenges of this subject, basically. Most of the time we have to prove ourselves right from the at home when we were kid. Having two brothers, I don't know, I should not, it's not a self pity, but I like to tell that is we have to prove ourselves more and more. The school which chosen for us, the school chosen for the, and I'm not going into a gender equality or anything like that, but honestly, we have to prove ourselves. Number two, when we started practice, especially particularly the environment in the women which are underrepresented. Lucky me that being a gynecologist, treat the females and the female branch mine is. So mine problem is not that much, but still I had to work extra hard. Number one, to is the prove myself, and number two is to learning the opportunities. For example, anything which I wanted to learn in future like that. So family first, work first, and then the learning opportunities is important. Why the females of the family, do I need to learn this much surgical skills more I should learn or I should not learn? So this was another challenging things, because we have to actively find out what is the mentorship we had. Do we have the valuable mentors or not? Like these are the point. But by staying confident and focused and a quality of work was there, I was able to overcome the challenges. But I think it's not the work balance between the family, it's a juggling. It's a literal juggling, which we have the struggles which we face.
We do understand that females in medical profession have more challenges to face because of dominance of men in that field in the past. But recently we have seen increasing number of females coming into this field and taking top position is a very optimistic and positive sign.
True.
Thank you for sharing your challenges that you have faced. How crucial do you believe mentorship and networking are for supporting and advancing women's career in STEM?
See, these two things are so much important. Number one is mentorship, and another is you talk about the networking. These are basically the fundamentals of any professional growth. If you have a good mentor, if you have a good networking things, that's the professional thing. But the women basically they face, you can say, additional barriers. They have that especially they face because mentorship there is less of mentorship over there, because mentorship is needed for all the challenges. They should have a good guidance. Basically, they should have to build a confidence into them. So these, especially the mentorship, is very, very important. Helping women to how to navigate the challenges, how to develop the leadership skills. They are another important, and empowering and inspiring also. Both of the things are. And networking, as today's we are seeing this is the new door of opportunity. And these ways we can foster with so many collaborations. Because of networking, we are able to talk over here. We are doing so many things because of networking. And networking basically expands the professional circle. For example, being a vice president into the Federation of OBGYN, it basically helps the female to, for all the professional circle, this expands. Then it helps in build their visibility. That's another important. And they create the sense of community, because in networking you cannot be like something unnecessary things you are going to produce, but there should be sense of communities there. So networking and mentorship, I think this is the number one thing which is support the career of the women. And the women's career is basically, it's not a 9 to 5 job. They also have a career. It's a career. It's not like it's not only the job. You can say like that. So this is the.
Thank you. What are your views about that despite so much of progress in this society, women are still underrepresented in STEM? Not so much now in medicine, but in other science and technology. So what are your views about the most significant challenges contributing to this disparity, and what actionable steps one can take to address them?
it will be too much feminist if I'll say that gender equality is needed, but gender equality is definitely should be there. So we have to discuss basically two most important things is we need a structural change and we need a cultural change. I think structural change is also very, very important because that will be more the inclusive one, the supportive environment will be there. And structural changes also in a shift in a culture like, for example, what I say, more access to the resources and the opportunities for the women researchers are equal. They should be equal, they should be equally funded also. The funding is also important. They should be more promoting to the leadership roles. They should have been recognized equally. So this is important point, and they should have a good mentorship program. They should have a good net opportunities, and that can help the confidence into the females. And in this way, we can support the system. That's what I feel it. So two important things: we need a structural changes and we need a cultural changes. That's very, very important. Structural for the progress, culture for equality.
Now moving to the role of research, innovation, and editorship in medical journals. As you know that there is huge disparity in the leadership positions, in the authorship positions, in the editorial board membership in various medical journals. So females are overall underrepresented. So from your perspective, what strategies can institution or journals implement to foster more inclusive and supportive research environment, especially for women?
First and foremost, they should work for their what is more they like. Like for example, in a healthcare, more they should work into the cancer research, infectious disease, or mental health sort of thing. They should work more and more like that. And the young women, most the changes which we need into the research thing is I already talked about the gender equality which we needed, which we should have. There should not be disparity, like encouraging women's to contribute their perspective. Number one. Number two, they should be given some free hands for that. For example, for if there is a family background thing, some problems are there, they should be taken differently than the males, like what I feel about. And I think they should be more and more promoted for what they want to work. Like this is my point into this field.
I think another aspect of it, if you see overall health problems, 50% may be related to women. And if women do not do research or contribute to research or are represented in journals, editorial board, and otherwise, these problems cannot be described and presented in a good form by male authors. And hence, we will not be able to find good solution for that. And hence, representation of females is very, very important. So, now, could you share your experience being with Apollo Medicine Journal as an editorial board member and elaborate on your specific contribution to the journal?
Actually, my journey with Apollo Medicine, you can say it's good. Thanks to you very, very much time. It was exciting and basically enriching experience. It's an enriching experience, and it allows you to explore, share the groundbreaking world in the field. Actually, particularly as you already talked about the field, like we do more and more work into the premature ovarian failure. We work more into the PCODs. We work on the subject which is very close to us. The more and more menopausal problems, postmenopausal bleedings, so all the gynec problems. So we have so many things which we can, as a gynecologist, I'm talking about the gynecologist, but my idea about working with Apollo Medicine is allowed to explore the many things into it, and it's an innovative method of putting your work in about medical treatments, any research, anything like that.
So how does Apollo Medicine, in your opinion, actively support or showcase the groundbreaking research conducted by women in the STEM field? Uh,
Correct. True. So, as you said, that this is the only journal, or you can say being an as you, there are the 25% females editors and everyone there. So, it's only not only publishing the high quality research as it's going on, we see, and the gender disparity is less, and encouraging women to contribute their perspective. I think it's important. And you're giving a chance. Gender equality is also there. So I think these are the few points which are very important. So given giving chances,
what could be your
you're not audible. Hello? Hello?
inspired to enter STEM fields, especially within research and healthcare?
For the youngers, my advice will be very, very simple. In the research and healthcare, they should stay curious. If there is a curiosity, that's the basic things they can do. They never should have the self-doubt. Another important point. And all because STEM is all about problem solving. No? We talk about this. There are so many challenges. Then the idea is there. So don't be afraid to ask the questions. That's another third point which I always like to say. First is no self-doubt, stay curious. Third is you should have the more and more you can ask questions basically, and do more and more startups and everything. Now the time has come that all the young females, they should do more startups in all these fields, and I think they should take all the new challenges.
And
They
on
can,
the top of it, can I add one more point
yeah,
for giving tips to the young women
yeah,
that do not ever underestimate themselves.
so true.
They are
I know,
they
true.
are equally good or sometimes even better than the top people in that field, including men. So if men can do it, surely women can also do it, sometimes even better.
Yeah,
So
yes.
don't
And another,
underestimate.
I'm just adding one more point is there are setbacks. There are setbacks, but they are the part of learning process, which I feel. And most important is persistence. Lage raho, like persistence is the key.
Right.
So and they should have
Persistence, passion, and positivity. Three
yes,
P's.
yes, and they should find out their own mentors. They should find out their peers. They should support each other. That and find out the like-minded people, and they build your confidence
What
and resilience.
what role, in your opinion, can institutions, journals like Apollo Medicine and other organizations can play in amplifying the voices and contribution of women in STEM?
Uh, for example, all the organizations, not only this, they should implement a transparent practices and equitable practices. Like for whenever they're selecting the individuals, they should not be the biased opinion over there. What are the leadership roles over there? They should have the supportive environment to acknowledge the what challenges females face, what women often face, how they balance the work life balance, which we sort I call it juggling, and the flexible working arrangements are necessary. These organizations should put in their way. They should offer the mentorship program. They should offer leadership training. They should offer and all the opportunities in which females are more visible, like the projects in which they take um, females are more visible into the program and priority give some priority not the by the reservation, but otherwise also they should have the encourage the women to use the what are the pathways for their career and how they can do it. So and it's most important, it should be equally accessible to all.
Dr. Kavita, equitability is one issue, but if you see that more than 50% or even up to 70% of the workforce in healthcare is women. But
Yes.
still, if you see on the top positions, only 10% of women roughly can reach. So there is a big disparity in the number of women working in the healthcare, but going to the top position. So what may be the reasons for it, and how you think we can address these so that women can have greater access to leadership opportunity within STEM?
Uh, I think most important point about this is uh, sometimes female they go back, like they want to reach on such heights, but they have 110 things to do other than those things. The most important, what the goal is, why their persistence lost. Number two, like we call it, nobody has reached on that post. Why you need, see, even we don't have the very less chief ministers even out of all the states which we are finding. Same with everything in all the organizations, like your organization, my organization. If we see the history of our organization, 80% are the male president over there, and last 10 20 years we have the female presidents. So number one point is, first the female should be have the right goal. They should say that I want to go for it, I want to go for it. Number one. Number two, there should be, again I say, they need a support. Not only support, at least they should be appreciated. They don't want only support, they need that they should be appreciated. They should be equally seen, like visibility should be equally seen, like everything. For example, their work should be appreciated. They should be promoted. That's what two things which I already talked about. We need a structural and a cultural changes that will help us to go on any level which we want. But still, we are having the endless possibilities are there now. We see, and the people are doing good. What we have seen 20 to 25 years back, and in next 20 50 years, I think things will also change in many more manner. That's it.
Thank you. Finally, I was coming to this point only, that how do you see the role of women in STEM evolving over next decade, and what changes do you hope to see, or you want to see in next decade?
I guess we are talking about the crux of it, or you can say the nutshell. We can say we need there will be more representation, there will be more opportunities, there will be cultural shift. Cultural shift is going to happen, and it will influence all the landscape will change. You see, because there will be totally evolving the exciting hoga Zara. That will be a transformation of, and then a push to the gender equality. It's going to happen. More women will be in a take leadership roles. More, not in academics only, but in the private sector, in the government sector, in the policy making, everywhere you can see this. And I think traditionally male-dominated fields, maybe they should work like more in artificial intelligence, space exploration, like and engineering, right? Engineering. I'm not saying the engineering, but engineering. And the shift will be more inclusive, I think, and collaborative. And innovations in a field like health technology, I think there is going to be change, lot and lot females will be there. That's what I feel like in 10 decades.
So that's a very optimistic and very positive thing, that we are seeing and hope to see more gender diversity in all STEM field, including medicine, including journalism, including editorship. And once we do that, I'm quite hopeful that our society, our level of understanding, our research, and more importantly, our healthcare giving to our patients, to the society, will be much better, cost effective, and better solutions will be provided. With this note, I thank you once again, Dr. Kawita, and we end this interview. Thank you very much.
Thank you so much for giving me the opportunity. I enjoyed talking to you, and I hope many more this type of webinars or interviews we can do. Thank you
We will surely do it. Thank you.
so much. Thank you.